welcome back. Jo Helcke here, pregnancy and postnatal fitness expert. How are you? How are things getting on? Are you getting back into exercise postnatally? I say that because this is one for you new mums. I want to talk to you about the sorts of exercises that you definitely should not be doing for the abdominals postnatally. And I say this because basically what I find is that most people, most women postnatally, the first thing they look at in terms of their body is the abdominals, and they think, oh my goodness, they really don't look the same as they did before I had a baby. And so then the first thing they do is rummage around in their brain and pull out the one exercise that they can think of that's for the abdominals, which is, yep, you're right, it's the sit-up or the crunch, whatever you want to call it. And that is the exercise that I am telling you you should not be doing postnatally, and I'll explain why. The reason is that for the vast majority of women, the abdominals actually separate out. Now, as you can see, I'm wearing a very bright pink top today, and it has a zip. And I tend to wear a top with a zip when I'm explaining the whole process of the abdominals separating in pregnancy, because it's quite handy, because basically the separation of the abdominals occurs just where this zip is. And it starts up here and finishes down near the pubic bone. So you end up with a separation. How wide that separation is depends on all sorts of factors. For some people there's no gap. It's a minority, but nevertheless it is a minority. You know, there's a significant number of people with no gap. But for others it might be one finger gap, i.e. you can fit one finger between the two sides of the zip, the two bands of muscle, or it might be 2 fingers, it might be 3 fingers, or even 4 fingers, depending on all sorts of factors. Now, if you can imagine, if you have a gap, a separation of these 2 bands of outer abdominal muscle, by the way, it's only the outer layer which is separated, so don't panic, all the other layers are intact, and doing the right sort of exercises will bring it all back together again, so don't panic. Anyway, if you can imagine having a separation, here it is, here's my separation where you can see the gap in the zip. Now, if I do a sit-up, this is what happens. Now, here's me, I'm doing a sit-up. I know I'm seated, but nevertheless, it's the same movement. As I squash forwards, look at what's happening to the zip. Yeah? It's poking outwards, it's opening up. That is exactly the same as what will happen if you do sit-ups with an abdominal separation. The separation will do that and will open out. So that's why I don't want you to be doing sit-ups. So there we are. The exercises to avoid are as follows. So taking it onto your back, I do not want you doing sit-ups because you will be opening out the abdominals and separating them out rather than letting them come together naturally. And I do not want you doing rotational work either. So all of this sort of stuff that everybody loves rummaging around in the brain and doing. So no sit-ups, no rotational crunches either, and no side planks. The reason being, again, so that's a side plank there. This is really strong work very strong work for the obliques, the waist muscles. And if you start working your waist muscles too soon postnatally, again, it will stop those abdominals from knitting together nicely postnatally. So it's all a question of going back to basics and doing some properly tailored postnatal Pilates deep abdominal exercise. That is what is the right sort of thing to be doing postnatally, and it will help you. So take heed, have a go, look at my postnatal Pilates exercises because they're there to help you, they're the right sort of thing to be doing, and you will see the results. So I'll see you on the forum, I'll see you on the website. The website is, of course, joannahelcke.com. Take care, see you soon. Happy, healthy, fit. Bye-bye now.